And hello and welcome to this week's Billing and Reimbursement live chat. This week we're going to talk about procedures which are often reported with CPT and HCPCS level 2. That's how you pronounce that, HCPCS, HCPCS. It's the way it is. You know, healthcare, if you haven't learned by now, healthcare is a bunch of abbreviations and acronyms with a word every now and then thrown in the middle. Okay, now you remember last week we talked about diagnoses and ICD-10-CM codes. And to remind you, we discussed this exact thing, the legal doctrine of medical necessity, which is basically to make sure that there is a legitimate medical acceptable reason for providing this patient with the services of a healthcare provider. Those services may be chalking something out. It may be advice. It may be an injection. It may be an examination. It may be open heart surgery. Okay. But there's got to be a medically acceptable reason for providing that based on the clinical standards of care. Okay. It's got to make sense. You don't diagnose a patient with a splinter in their finger and amputate their toe. Not if you don't want to go to prison. All right, but that's not us anyway. All right. So again, we talked about this last week, but now we have something added to it, okay? Last week, you learned the second bullet. Diagnoses explain why the patient required care. Now, procedure codes explain what the physician or healthcare provider did to or for the patient. Okay, so diagnosis codes are the rationale, the justification. Procedures are the actions. Okay, and remember, these two pieces, diagnosis and procedure, must align with the standard of care regarding humans. Okay. All right. So that's very important that you understand that. That's the underlying aspect. And as I said before, when we say the term procedures, it really is more of an encompassing aspect, procedures, services, and treatments. So procedures would be surgical, not major surgery. It could be, okay, but it could be something like removing a mole in the doctor's office to open heart surgery or repairing a fracture or whatever, okay? That's generally what we mean by procedure, okay? Services generally are more advice, counseling, examinations, and note, when we say counseling, we don't necessarily mean psychiatry or psychological counseling. This could be a patient going to a physician to discuss getting ready to have a family and getting ready to be pregnant and anything that, you know, what do I need to do to prepare my body, okay, or whatever. All right. And then treatments will generally, again, apply to services such as acupuncture or physical therapy or something like that. Okay, so you can see the differences, but the general overall aspect of this is a physical action. And yes, talking is considered a physical action. It is for me because I'm a teacher. And it is for healthcare professionals because they should be talking about important advice like stop smoking, do not jump off the roof of a garage. Okay. All right. Types of procedures, and this also is important for you, especially for those of you going into coding, because it makes a difference. It makes a difference in the overall aspect of the patient's well-being, and it's important for you to know the difference. So we have preventive procedures. These are determined by science. These generally have the patient coming in not for any signs or symptoms, but okay, I'm 50, I'm here for my colonoscopy. Oh, they lowered the age to 45. Yeah, lucky. Oh, yeah, that's so much fun. Okay. Or a vaccination because it's October, I have to get my flu shot. Or annual mammogram or PSA, prostate specific antigen. That's the male well, that's a blood test, but then the man, you have to get that stuff checked out. Okay. All right. So all of that is preventive, and preventive includes purely preventive, such as a vaccination, as well as early detection, which is like a mammogram. Okay. A mammogram does not prevent a woman from getting breast cancer. Oh, if only. Okay. But it enables early detection, and the earlier things are diagnosed, the less damage they have done to the body, the less damage the surgical or the treatment for that will do to the body, the less it will cost. Okay. All of those are really important for early detection. Okay. So I just want you to understand the difference between preventive, as in purely preventive, you will not get sick, to preventive, which is really early detection. We can't stop you from getting breast cancer, but the sooner we know about it, the easier it is for the patient and everybody. Okay. Does that make sense? Okay. All right. Now we have diagnostic procedures, and diagnostic procedures are used to confirm or deny a diagnosis. There are a lot of diagnoses, almost all of them, that require looking inside the patient. Okay. So the physician will document patient's signs and symptoms. And remember, we talked about this last week. Signs are provable. I put a thermometer in your mouth or at your forehead, and I can confirm or deny, I can prove tangibly that you have a fever. Okay. Or it can be a symptom, which is the patient's opinion. Okay. The patient, I feel tired all the time. My muscles hurt, my finger, whatever. Okay. So a symptom is not provable. It still has value, of course, because the patient is telling you something. Okay. But in most cases, we then have to go to confirm a diagnosis, because you don't want to waste time treating a patient for something that they don't have. Then you waste time. The condition gets worse. You waste money spending money on medications or treatment that's not going to work. And a good example of this is we can do an x-ray and confirm the patient has pneumonia, but without a lab test to tell us what the pathogen is, you can't just assume it's a bacterial pneumonia and treat the patient with antibiotics. Sorry, no, because viruses cause pneumonia, fungi cause pneumonia, as well as environmental situations. So you give the patient antibiotics, it not only wastes time and money, okay, it's not going to resolve the pneumonia. Wait, okay. Patient's getting worse, okay? And meanwhile, one little lab test, and you can tell exactly whether it's bacterial, antiviral, whatever. Also, taking antibiotics, especially when you don't need them, makes the body work toward immunity to antibiotics. And then when you do need them, your body will not react and you will be resistant. You don't want that. Okay. All right. So diagnostic tests, imaging, x-rays, MRIs, CT scans, lab tests, i.e. blood work. It could be a sputum test, spit here. Okay. Or it could be a biopsy. But the purpose of this is to determine exactly what the diagnosis is or isn't. Okay. And then therapeutic procedures, the purpose of a therapeutic procedure is to repair something that's not working inside the body very well. Okay. So a therapeutic procedure might be to remove a gallbladder because there are stones and it's not functioning properly. So we just remove the whole thing. Or a therapeutic procedure might be to go in and piece together a fracture, a compound fracture, so that the bone parts are all aligned so it can heal properly. Okay. And every and any variance with that. But it's important for you to know which type of procedure is being ordered. And again, the reason we made you take anatomy and physiology and pathology is because you still have the responsibility, yes, as the coder reading the documentation, you still have the responsibility of making sure medical necessity is expressed in this documentation. Because if it is not, you need to go back and query the doctor and get it straightened out. Otherwise, no money. The patient's going to have to pay out of pocket, even though they really shouldn't have to, because if you would have gotten it right, the insurance company would have paid or the third party would have paid. Okay. All right. So yes, all of this intimate knowledge is important. Now, procedural approaches, these are important both with CPT, outpatient and physician services, as well as ICD-10-CM, which is, I'm sorry, PCS, ICD-10-PCS, which are procedure services provided to inpatients in the hospital. You need to understand the approaches. And what this means is doctor outside of the patient's body, problem inside the patient's body. How does the doctor get there to fix it, to take a biopsy, to figure out what's going on? Okay, so open is the old-fashioned way. We take a scalpel and we cut. Okay. And very often the documentation in the operative notes or procedural notes will state this: an incision of 12 inches, 2 inches, whatever was made. Okay. Percutaneous. Percutaneous is a small puncture through the skin. Now, this is important because this might be, again, to take a biopsy to withdraw bodily fluids, okay, or to extract pus or something like that. All right. With a percutaneous procedure, you need to keep your eye out for any imaging that is accompanying this. In other words, to guide the physician when he cannot see where that needle is going. Okay. All right. Laparoscopic, and you may have heard of this. Okay. These are typically it's 3 incisions in the abdomen. One incision is for a camera to be placed inside the patient. Another is for the surgical instruments. And the third, generally, is to blow air or gas into the abdomen or the area to move organs out of the way so the physician can see where he or she is going. Okay. And via natural opening, which is done more and more these days because it is so much better for the patient on multiple levels. And essentially, this is going through the nose, through the mouth, through the urethra, the tube that goes into the bladder, right? The vagina, only women have these, and anus, okay? And this is much better for the patient because no incision means no opportunity for infection at all. So there is a faster healing process, faster recovery as well. Okay. Very, very important. So the anus, for example, would be an entry point for a colonoscopy. Okay. The mouth would be an entry point for an endoscopy, going down either the trachea into the lungs or down the esophagus into the stomach. Okay. You have to read carefully and understand what is being documented because the approach will change the code. Okay. All right. Now, location, location, location. No, we're not selling real estate today, but it's important that you understand that procedures can be done in any of these places, all of these places. Okay. Physician's office is considered outpatient. So you would use CPT to report the procedures performed in a physician's office. An ambulatory surgical center, sometimes called a same-day surgical center, and the hospital outpatient department. So the difference between these two, the hospital outpatient department is under the same roof as the inpatient under that hospital. Ambulatory surgical center are generally independent, freestanding. Okay. And those are also both outpatient, considered outpatient, and use CPT to report procedures, services, and treatments. Okay. And inpatient is where it changes. When a patient is officially admitted into the hospital, CPT is used to report what the physician did, the physician's actions. Okay. But the rest of the procedure performed and provided in the hospital by the hospital are reported by ICD-10 PCS. And if you are studying inpatient coding, you will have a full class all about ICD-10 PCS. I like it. Okay. All right. So you have to know where it was happening. And again, this should be in the documentation, of course. Okay. CPT, we keep using the abbreviation, but you need to know CPT stands for Current Procedural Terminology. This code set, unlike ICD-10-CM, ICD-10-PCS, and HCPCS, unlike those, CPT is owned and maintained by the American Medical Association. They own it. You can't write about it. When I write my books on coding, we have to get special permission from the American Medical Association for me and Ms. Johnson. We're co-authors to write about CPT coding, how to do it, what it is. Okay. All right. Annual updates are effective January 1st every year. It's not unusual that they may release additional codes in July, but they're not mandatory used until January 1st. Okay. So that means October, November, December, you all have to be on the lookout for the new updated CPT coding manual or updating your CAC, your computer assisted software, whatever it is, you are required, and claims will be denied if a code was deleted January 1st, the patient was seen on January 2nd, and you use codes from the previous year. They will be denied. You don't want that, or rejected. Okay. And the easiest thing for you to remember, because you need to be able to identify a code, at least which code set it is from, okay, is CPT is 5 numbers all in a row, no dots, no dashes, no nothing, just 5 numbers all in a row, just like you see here, okay? So remember, last week we talked about ICD-10-CM diagnosis codes. All begin with a letter of the alphabet, followed by 2 characters, and then there's a dot between the 3rd character and the 4th character, all the way up to 7, okay? CPT, always 5 numbers, always 5 numbers. Okay. Now, HCPCS level 2 codes, what does that stand for? Healthcare Common Procedural Coding System, HCPCS. 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 There's no S in the middle, so it's HCPCS. Okay. But that's what people are talking about whenever you hear that, if you hear that in the real world. Okay. All right. Yes, we call it level 2. Level 1 is actually CPT codes. The CPT codes are officially categorized as HCPCS level 1. All right. We don't call it that. We call it CPT. Then we have CPT HCPCS level 2. HCPCS level 2 codes are used for ancillary services and home services and everything else that does not already have a code in CPT. Basically, this is the bucket, okay? It was, well, I don't know, we'll just throw it in there. All right, easy to recognize. These codes have a letter of the alphabet followed by 4 numbers. No dots, no dashes, no nothing, okay? So a letter of the alphabet with 4 numbers, HCPCS level 2. 5 numbers straight, CPT. A letter of the alphabet followed by 2 characters followed by a dot, ICD-10-CM. Okay. Now, the most common contents or items that are covered with HCPCS level 2 codes is identified by the acronym DME-POS. And that stands for DME, Durable Medical Equipment. This is any equipment used by a patient only because of a healthcare issue. And the durable part is it's got to last a long time. So it means last a long time or able to use with multiple patients. All right. So what's a good example of DME? A wheelchair, a cane, a hospital bed. But if you're reporting it with HCPCS level 2, you're reporting a hospital bed that is provided in a patient's home. And if you've ever seen somebody who is chronically ill, very often they will have a hospital bed in their home because it's more comfortable, it's more agile than a regular bed. And it's also narrower, so it's easier to get to the patient to change a bandage or whatever. Okay, so durable medical equipment, wheelchairs, canes, hospital beds, things like that, nebulizers. Okay. P in DME-POS is prosthetics. Now, a prosthetic is a piece of equipment that is used to support and aid a portion of the body to improve its function. All right. So I'm sorry, that's totally wrong. Prosthetics is a piece of equipment that is used to replace a missing body part or organ. Okay, prosthetics replaces a missing body part or organ. So we have our wonderful veterans coming back from the war, missing an arm or a leg. They're given a prosthetic leg. Okay. And very cool. Excuse me for 1 second. I guess it's about 10 years ago now. A university used a 3D printer to create a prosthetic arm for a little boy who was born without. And it worked fabulously. Now it's commonplace, but how cool is that, right? Orthotics is the other one. Orthotics is a piece of equipment that's used to support and enhance the function of an existing body part. And if any of you know anybody or have had problems with your feet, you may have used an insert in a shoe that was specially created and designed to help your gait or balance or something like that. That is an orthotic. And supplies is supplies. But these supplies would only be reported when it's above and beyond the norm that is being used in any other procedure, service, or treatment. Okay? All right, that's a lot of stuff. So what am I going to tell you? Oh, wait, I have this example. So I wanted you to see it all put together from what we discussed last week and what we discussed this week. Diagnosis, procedures, and ancillary services. All codes must align with the standard of care. So we have M21.611, which is a diagnosis code from ICD-10-CM that reports a bunion of the right foot. That's what the problem is, what the patient has, the diagnosis, okay? So we're going to do surgery on this patient, which is reported with CPT code 28289. This is outpatient surgery, by the way. So whether it's done in hospital, outpatient, an ambulatory care center, surgical center, doesn't matter. We're using CPT code 28289 to report hallux rigidus correction, which is the Latin term for bunion of the foot, hallux rigidus. And there are different kinds, by the way. So, but that's why you took medical terminology. All right. And then before we let the patient out of the surgical arena, we have to put a cast and very often a surgical boot or shoe so that the cast, so the patient can walk on it. Okay. And the surgical boot, as an example, would be reported with L3260, which is a HCPCS level 2 code to report the provision of this piece of equipment. Okay? Does that make sense? And you see how it's all logical? Bunion of the foot, correction of the bunion, surgical boot after the surgery. Makes total sense to me. Does it make sense to you? Well, you know what to do if it does not. If it does not, you are going to email me and we can discuss it. Okay, we can email back and forth, which I like because then I can explain it in the email and you can print that out and use that as study notes. Okay. Or we can set up an appointment to talk on the phone, or we can set up an appointment to do a one-on-one Zoom or FaceTime, whatever works for you. I am here to support your learning. I am here to help you take the next step as you move forward to a successful career. And yes, that was a pun for the surgical boot and the bunionectomy. I know. Okay. Have a wonderful, wonderful day and rest of the week. And email me to tell me how I can help you. Okay? You got it.